Hello everyone, I'm Dr. Himasri. Welcome to my channel Surgery Nuggets. Today's topic is phyllodes tumor, also known as cystosarcoma phyllodes. Usually, these are benign tumors seen above 30 years of age. It is a true mixed neoplasm comprising both epithelial and mesenchymal elements and resembling a fibroadenoma known as biphasic proliferation. Clinical features: it is a large breast tumor with rapid growth. The tumor does not involve nipple, hence, there is no nipple retraction. It does not involve the breast skin, so there is no fixity to breast skin. The chest wall is also free of the tumor. As it is a sarcoma and it spreads via hematogenous route, there is no axillary lymph node involvement. The tumor has a bosselated appearance. Hemorrhagic and necrotic areas are seen inside the tumor, giving it a cystic consistency. Diagnosis: the tumor is diagnosed from history and examination and confirmed from biopsy. This is the biopsy of a phyllodes tumor showing greater cellularity, nuclear pleomorphism, and leaf-like stromal overgrowth. Phyllodes are classified according to histological behavior. There are three types: benign, borderline, and malignant, based on the mitotic rate. For benign cases, wide local excision done with 2 cm margin along with the overlying skin and underlying pectoralis major muscle because of a high risk of recurrence. For borderline or malignant variety, we can go for simple mastectomy. No need of lymph node dissection as the spread is hematogenous. Post-op radiotherapy can be offered. Systemic chemotherapy may be offered for the malignant phyllodes. This was a brief overview of today's topic. If any doubt, kindly post in the comment section. For more videos, subscribe to my channel and click on the link in the description below. Thank you.